Kia ora and welcome to the first checkpoint of 2021. You may be feeling a slight sense of deja vu. It'll be another 48 hours before we'll know if more COVID restrictions are coming. This afternoon, health officials confirmed the new community case of COVID-19 is the more infectious South African variant of the virus. The 56-year-old woman is the first community case of COVID since November. And the COVID-19 response minister, Chris Hipkins, says she caught the virus from another person in MIQ at the Pullman Hotel in Auckland.
The two people occupied rooms in close proximity to each other on the same floor of the Pullman Hotel, and I'm advised by officials that they are confident that the infection was a direct one and that there is no other missing link in between those two people. We don't know exactly how the infection took place at this point, and investigations on that are continuing. That includes looking at CCTV footage from the Pullman Hotel to identify when and where they may have come into contact with one another.
Soon we'll have Dr Ashley Bloomfield on what the next steps are in the response to this case. But first, some people in Northland waited more than 7 hours to get their COVID tests today and described the process as chaos. Thousands of people turned up to testing stations across the region, with additional stations added in Helensville and Mangawhai to keep up with demand. As one Whangārei testing station reached capacity, staff sent people to another swabbing centre across town, only for them to sit in their cars for hours with no word on when they would be seen. Now that's prompted calls for better communication and resourcing for the north, where tensions are running high. Our reporter Nita Blake-Persen and cameraman Nick Munro are in Whangārei and filed this report.
The call to get tested was heard loud and clear in Whangārei. Cars snaked down this main road and filled the car park as those inside faced a nervous wait for their swab.
I would have thought that it would have been more organised. I knew there was going to be a wait, but I thought it would be more organised. There would be more people on, sort of here to help. But it's just chaos. Maybe 750 and 900 people, I'd say.
Whangārei woman Janine was one of the first to arrive this morning. She isn't allowed back at work until she gets a negative result.
I've been to the same place, but I also have a colleague that's been to another place as well, and I've had contact with her. Somebody needs to be down here telling people what's happening, and there needs to be something done, because if I'm here till 4 or 6 o'clock tonight and my tests don't get done till tomorrow, then I've got not back to work till Thursday. I mean, they knew yesterday this was happening. They put it on the news at 4 o'clock, so they've had at least 2 or 3 hours to get something sorted, surely. It's happened before. It's not as if it's something new.
It's 26 degrees here in Whangārei, and the hundreds of people who are lined up in cars or waiting in the car park have been baking in there for hours. They're frustrated that up until recently there haven't been portaloos, they've got no access to water, with many people leaving this line out of frustration around when they're actually going to get tested. Lindsay Dunn is among those to have waited in the heat, but he's seen plenty of others who haven't.
My simple view is that, if people leave and then they're asked again to do this, they just won't. Because, again, I get it, it's a difficult time, but cripes, this isn't new for the DHB, so they should, I think, should be better geared up than this.
This wasn't his first port of call for a test today, as stations across the region filled up.
Went to Kamal first, and then just got to the start of the Whangārei, and then they sent me here. They said, no, they were full to capacity, so come down here, so yeah, I came here.
There were around 4 medical staff testing and collecting details from those lined up here. Checkpoint was told by people waiting that at one point there was only one nurse for the hundreds waiting to be tested.
Well, poor buggers are caught with their pants down, haven't they?
What makes you say that?
Well, they haven't got enough people, but that's not their fault. That's just how it is, and we just have to accept it.
Contact tracing on the Northland community case has identified 15 people as close contacts. Everyone lined up here had a connection of some sort.
Her sister's auntie was in the same shop 2 hours after the case last week, so we're unsure. We just come down to be, safe, because this one's got low white body cell count, so safer than sorry.
She woke up this morning with a sore throat. Whole house has actually got a sore throat. Partner works in Ruakaka, which is basically where it started. Yeah, she's not doing too well, as you can see. She's got no clothes on at the moment. Yeah, she just need to get tested. We're immune compromised, been here since 8:30, so it's now nearly 1 o'clock. I've been crying most of the morning because I just want to get it over with.
Very, very boring.
How long have you been waiting for?
I don't know, but very long. Maybe 3 hours? I don't know, but way more than 3 hours probably.
Northland DHB was not available for an interview tonight. In a statement, it said community testing had been expanded in response to public demand. An additional centre was set up in Helensville, in Tamaki Makaurau and in Mangawhai. But that may be too little too late for those who couldn't stick around today, as others face an anxious wait for those test results to be returned. In Whangārei, Coordinator Blake-Persen, aho.